Hello divers, this is Dr. Kang's scuba diving story again. Recently, a friend of mine asked me if he can dive after he took out some small brain tumor out. So I thought, yeah, this can be a subject that can people be interested in. This is the social network service question, and this is my answer. To talk about it, let me mention briefly on brain tumor. And brain tumor can either be benign or malignant. The end result is the same. I mean, regarding the scuba diving. When we have a brain tumor, usually we grade them by 1, 2, 3, 4, and usually a malignant is grade 3 or 4. What we feel when you have tumor, but this is more medical thing, but I think it's worth mentioning. So you have headache which gets worse and worse, and then it comes more frequently. Nausea and vomiting. Sometimes you have some problem with your sight, like a diplopia. You see two things on one, and blurred vision. Your hands or arms and legs can get some sensory or motor function problem. You lose your balance, slurred speech. In ordinary life you can be quite confused. Some people show personality change or behavioral change, get very violent all of a sudden. If you have a seizure that you never had before, then this is a very serious case. You can lose your hearing. So whatever is the symptom, you take the tumor out. So after brain tumor is taken out, when can I dive, or can I dive? The conclusion is yes, you can dive. But you still have to meet some conditions. So the first thing is your physical condition has to recover completely from the disease and from the operation. Also, you should not be seizuring. You should not converse. Also, you should not be taking any anti-conversive drug. This can be defined only by doctors. So you have to consult your own neurosurgeon. Am I still prone to a seizure? Doctors know if you still have the problem. So make sure you are doing okay in life, in usual living, and also you should never be converging. You don't want to go through this underwater with your mouthpiece. When people have pituitary tumor, all time we used to do open all the cranium and do something with the brain also. But now most of the pituitary tumor is done through your nose. You open your nasal septum, push in some things to open up the pituitary area. This gives some trauma to your nose and sinuses. So if you have done this procedure, you have to check with your doctor and your ear, nose, throat doctor. If your sinus is okay, if your nasal cavity is okay, and if you can equalize those areas with no problem. Otherwise, you should not. So you need some meticulous checkup before you go diving. If you still have some defect in your cranium, your skull bone, you should not dive. It's the same with any other activity. So make sure that the defect is covered with the surgery or after surgery, and then you can do it. Some scars on your head. This usually scar heals in like a month, but sometimes when they use some very thick material to close the suture, there's some holes left, and that can also be a source or a root of infection. So this is minor, but it still means something. And the last thing you have to consider is when you have a malignant tumor, cancers, doctors prescribe some anti-cancer medication. Some of them can damage your lungs. So you have to do some pulmonary function test before you decide to dive. These are the concerns we should put in consideration, but otherwise, yes, we can dive again. So today's Dr. Kang's scuba diving story was about brain tumor surgery and diving. Thank you for attention, and thank you for listening.